everyone, and welcome to an SDOH Field Guide presented by Advocate Advisors. I'm Michael Sattler. Social determinants of health is a concept on everyone's lips these days, but there's also a wide variety of opinions and perspectives on what it all means and what to do about it. Now, it's a fast-moving space, so there's a lot of confusion and questions drifting around. Now, we happen to think that SDOH is the future, and the more clarity and consistency we can bring to the space, the faster it can go from being a hashtag to being an actual discipline. So here on the Field Guide, we'll try to answer your questions about SDOH in a pragmatic, no-nonsense way. If you've got SDOH questions you'd like to see on the air, tweet them to @SDOH Field Guide or email them to me at the email at the end of this video, and we'll try to get them on the air. And don't forget to subscribe and hit the little bell to be notified when a new video drops. Now, for our first episode, we figured we'd start with the basics. What is social determinants of health, and why should I care? Now, this is a great question, and something people outside the healthcare community ask themselves once they hear this term. So let's start with some numbers. The healthcare industry for a while now has recognized that as much as 80% of health outcomes are determined by factors happening outside the doctor's office or the hospital. Some say much more. Your genetics, your behavior, your social circumstances, these things have little to do with your interactions with a clinician or a doctor, but they can have a significant impact on your health outcomes. Now, the social roots of medicine go back all the way to the 19th century. Rudolf Virchow was a German scientist who was not only known as the pioneer of modern pathology, but wrote this: "Do we not always find that the diseases of the populace are traceable to defects in society?" Even Friedrich Engels pointed out the connection between social conditions and health in 1845. Yes, that Friedrich Engels. Now, do you remember that amazing map that was made of the cholera outbreak in London's West End? By plotting deaths on a map, they found clusters and figured that everyone was getting sick from drinking from the same water pump. Now, these people lived in a slum and had no choice but to rely on a public well. Relocate the pump away from the latrines, and voila, you cure everybody of cholera. Get clean running water into the buildings and flush the sewage away, and you do even better. So people have been talking about SDOH for a long time. In fact, at this level, SDOH is more or less synonymous with many definitions of public health. Now, in 1946, the actual constitution of the World Health Organization defined health as a complete physical, mental, and social well-being. By 1978, controversial medical thinker Thomas McKeown had argued that the biggest decreases in mortality and advances in life expectancy for particular diseases occurred before the introduction of improved medical treatments for those conditions, and even before public health campaigns like sanitation and nutrition were actually launched. His argument was that better social conditions meant better health, period, and that doctors were really just an afterthought. Hence the controversial part. So now, when people ask you about SDOH, you can say that it's been a thing for a century and a half. For our present purposes, the term SDOH actually officially goes back to 2005, when the Commission for Social Determinants of Health, CSDH, was established by the World Health Organization. Now, that led to a series of reports and analyses that pointed out the connection between health and social factors in detail and with data. In the United States, the National Institutes of Health and the CDC and HHS have made SDOH an important topic for at least the last 15 years. For many people, SDOH has become synonymous with advocacy for health equity and better public policy. The COVID pandemic in particular has highlighted evidence that bad health outcomes are correlated with lower standards of living. And in many cases in the US, this falls more heavily on communities of color. Now, as we've seen, this reality is nothing new. It goes all the way back to Victorian London. But there's a new awareness of how this is a result of policy failures and systemic and institutional structures.